Good afternoon, everyone. We're going to wait a few more seconds here as it looks like the participant number is climbing quickly. So we will give a minute for everybody to get on here. Okay, looks like that's level. So we'll go ahead and get started. Good afternoon, everyone. I'm Michelle Norum. I am a project manager here at CRISP, Maryland, and I focus on social determinants of health. I'm also joined by Christian Metzger and Viniam, who are both on the team as well, who assist with our SDoH work. Just a reminder that this webinar is being recorded. And the chat function is available. If you have questions, feel free to put them in there. We will be monitoring that. And then we will also take some questions at the end to go over things. So let me share my screen. All right, great. Thanks again for joining. This is Kristen, the Social Determinants of Health. All right, so why are we talking about social determinants of health today, and what does that have to do with CRISP? So one of the really important things that we focus on here is making sure that we're able to show really that whole person record and incorporating social needs as well as the clinical aspects and recognizing how important those other needs are, such as socioeconomic factors, physical environment, health and behaviors, and then as well as that healthcare. What are some of those challenges that we've been encountering, though, as we do this? We really recognize that everyone has different needs. Different regions within Maryland have different needs, different healthcare systems, community-based organizations, local health department, and the state all have different needs that they're trying to meet. We also recognize that everyone has made investments in tools, workflows, and systems, and understanding what works for each person is really important to us. We also recognize that clinical and social care systems are siloed. And so we're really working on bringing those together. So keep that in mind when we're talking about the tools that we're going to go over today. Is our key features at CRISP are really to support interoperability and integrations first. So that's really meeting with each of you where you are with the tools you have and making sure that we can support that and share that information in CRISP to really give that whole person record. We are agnostic to all tools and vendors and workflows, and ensuring that we work with all of you to make sure that we're able to pull in as much data as well as have tools available for those that don't have those tools. So just a high level here, how we pull that information in. First, we have all the clinical data that you are aware of that we're able to pull in to CRISP. Then we have our social needs data. So that would be screening information, referral information, and then intervention data. So that is our closed loop referral tool that we do have, pulling in that information and pulling that into that whole person record. And then information goes out depending on if your organization is HIPAA or non-HIPAA covered. The first piece I want to talk about is our screeners that we have in CRISP. So this is a view, these are for people that have clinical access in Context. So this is a view from In Context or the portal. As you have the clinical access, you can go over on your tab to the social needs data tab over on the left-hand side. And if you click on that, that will pull up different assessments or screenings that we have around SDoH. We also have conditions under the conditions tab that will show Z codes. I will say that we have a limited number of Z codes. I believe it's less than 5% of people have Z codes just because they're not utilized as often. But we do have the assessments and screeners here. You can see that here under the date in the middle here. Once you click on that social needs, it will list for under each patient the date the screener was completed, the source. So the source will be the organization standpoint. So this is pulling from test data. So we want to be able to show like could show Hopkins here, or University of Maryland, Emeritus, wherever we're pulling the screening information from, as well as a description of the screener. The description of the screener could be a couple of different things. If it's a standardized tool, the two main standardized tools that are used are the Accountable Healthcare Communities Screener, or AHC screener, or the Prepare screener. Currently, all of our MCOs are required to complete the Prepare screener on all of their members at least once a year. And so we receive that data and pull that in here. So you would see Prepare for the MCO screeners. If it's what we call a homegrown screener, it would have the name of the organization there. So such as if somebody has a customized Epic wheel, it would have the name of the organization and Epic wheel after. A key piece to look at when looking at this is if there is an orange flag. That orange flag shows that a need was identified from the screener for that patient on that date. If there is not a flag there, that means no need was identified within that screener. So that would prompt you then to click on that individual screener here. And then it would pull up all of the categories and questions from that screener. So each screener that we have is mapped to one of 13 categories, such as housing, food, transportation, interpersonal violence, social isolation, and so on. So each question is mapped to a category. And so you would see that flag that Anita was identified at both the category level as well as the individual question level. How do we receive this data? So we work with organizations to send us files of their screening data from their system, usually sent either daily or weekly. And if that's something you're interested in sharing with us that you're not, if your organization currently is not, I will be the best contact for that for you, and I will share that at the end of the presentation. If you do not have a screening tool and you would like to have a direct entry screening tool, we do have that available as well. So we have a separate tile called Screener, and here it has the standardized tools such as the AHC and the Prepare. We can also, if your organization wanted to have a customized screener that you wanted to ask specific questions, you can send that to us and we can put that in here. And then you would be able to go into an individual patient's account and then answer all of those questions. And then it would show up just like this previous screen here, it would show up in the exact same way if a need was identified or not and be flagged. So that's an overview of our different SDoH screening tools. And this is how I want to talk a little bit about how we're pulling in different information from different systems. So a medical professional refers a patient to a community resource, right? What could that community resource be? So reaching out to an individual community-based organization or a CBO, a government agency such as your local health department, social service agency, and sending that referral information through there. So we're working with those organizations to be able to share that information in CRISP. Also, you may work with a network referral platform, such as Find Help, Unite Us, those larger health systems. We are working with them to be able to pull in, excuse me, referral information and share the referrals that have been completed. And then we also have our closed loop referral tool that we're going to go over how to do that here shortly. But all of that information, we're working with many different partners to be able to pull in that referral information. Okay, how do you access the ability to send a referral in CRISP? So I want to talk about, there's two different ways depending on the user type you are. If you work in context, so in context is if you're working within CRISP, within your EHR. So if it's integrated, such as an Epic, and you access Chris that way, you would access it here through your panel. I think one of the important things at the bottom is there's this little arrow when you log in, because currently all you see is these little tiles. If you hit the arrow at the bottom, it will expand them. And then you're able to see the names over them. Otherwise, you have to hover. But what you would click is apps. And once you hit apps, the page will refresh and you would be able to see the create referral, which has a little pencil tile here to be able to send that. If you have clinical access, you automatically have this create referral tile available to you. The second way to send that referral would be through our portal or our web-based application. And in order to do that, you would just put in your patient's first name, last name, and date of birth, hit search, find your patient, and then a really important piece here is you would just click on the patient's name, and then these different options will show up, and then you would click on create referral. So again, you do have to click on an individual patient's name for that create referral to come up. One other thing I will say about web-based, users don't automatically have the create referral tile. They do have to request that from their HIE admin. And so if it's something that you want, all you would have to do is reach out to your admin at your organization, and they can easily add that create referral tile for you. So no matter how you hit that create referral button, you will come to the search page. So the search page gives you two different ways to search. The first is up at the top here under organization name. If you already know the name of the organization, sorry, that's the second option down here. You can just type in the name. You could even just put in meals for this example of Meals on Wheels. You could just put in that name and click find organization, and options will come up for you. If you're not quite sure what you're looking for, you can also put in, such as a Google search, the different name for resources such as housing, transportation, whatever that need is. And then you can also narrow down by zip code or address, and then a search radius. So you have two different options to search within the referral directory to be able to find resources. Once you get into the search results, we have a couple of different ways to view results. Once you put in that search, the first things that will come up are any referrals available currently in the CRISP directory. You will see that under the source here where it says HIE directory. Anytime you will see that, they'll have a box on the left side. That box means that you can send an electronic referral through CRISP. So anytime you see HIE directory and the box, that means you can send electronic referral. Those will always be your first options in the search when you hit the search bar. Below that, we are then connected to 211. So we have a direct feed to 211's resource directory, and they have over 7,000 resources. And that's pulled up and available to be able to give a patient different resources, giving them a telephone number, and general information about a program, but you are not able to send an electronic referral for those. It's just the resource directory that's integrated into CRISP. So now we're going to talk about these 300 resources that are available in CRISP that you can send a direct referral. So the first step is that you would check the box next to the organization and program that you wanted to send that referral. Once you do that, this button will appear. It says create referral for program. So you would first check the box, create for referral for program will come up, and you will click that. And then this page will come into view to be able to fill out and submit. We're going to go over each of these individual sections, but as you can see, it's just one main form to fill out. So the first section, section 1, is called patient information. Under patient information, the majority of this will be filled out for you. So this pulls from our MPI or our master patient index. So all of the patient information comes over from the name that you clicked on or the chart that you're in. And the only thing that we ask is updated is the telephone number. So we want to make sure that the community-based organization or whatever resource that's receiving the referral has that correct telephone number. And so you're able to, so please update that number, or you can put in an alternate number. The second part, second and third part are, the first one is patient insurance. So patient insurance, the only required piece of that is putting in the carrier type. Also within the form, only if it has that asterisk next to it is it a required field that must be filled out to submit the form. So we have the just high level overview, high level options to choose from for patient insurance, such as commercial, Medicare, Medicaid, heart funds, unknown, and none, to be able to select that. You do not need to put in the carrier group ID or member ID. That is not required unless the organization asks for that. And that would be right below in the description. I believe currently I think we only have 2 of the 300 programs that actually ask for the full insurance information in the referral. So it's not very often that you would need to enter that. And then the section 3 is the actual referral program. So that's just to confirming where you're sending the referral to. So for this example, the organization is Mac Living Well. They have, the program name is Fitness and Exercise. The source is the HIE directory, and then it gives an overall description of the program. That's really just confirmation that that's the correct program that you wanted to send the referral for. Right below that is then a free text box. So that's where you're going to put any relevant information that would be important for the organization that you're sending the referral to know. This could be things such as the person needs an interpreter, or also transportation, or they have transportation issues, or anything else that's important for that referral. There is also the opportunity to attach a file. So you can hit choose files and attach any file that might be necessary. The last section, section 4 and 5, are putting in the who sent the referral. There's 3 options for this. So one is automatically use my information. Second is search for provider information. So this may be depending on your workflow for your organization. A nurse or a care manager may be sending on behalf of a provider. In that case, you can click search and you can put in by first and last name to be able to find the correct provider. And then you can also manually enter the provider information or your information if it doesn't come up. If you're logging in from the web page or from the portal, automatically will always come up with your information. If you're going from in context, sometimes it won't necessarily match, so you may have to enter your information, but the majority of time it does pull in that information. Everything will come up except for the phone number, which you will have to enter a phone number there. Again, anywhere there's a red asterisk. And then the final section here is the patient attestation. And so that is just saying that you spoke to the patient and let them know that an electronic referral is going to this organization for your whatever service you're referring them to through CRISP. And then you would check that box and then hit submit. So it's just a few clicks to be able to send that referral. I do want to talk about, we do have a couple of different custom forms currently within CRISP. So sometimes you may see additional questions based on what programs you're going to. An example of that may be a diabetes class or a DPP program. There are additional questions that may come up, such as patient vitals, A1C, those type of things may come up. We also have a couple of workflows projects right now around the postpartum and prenatal forms, the PMR and EMPRA. So we have additional custom forms for that. So I just want you to all be aware that there could be a custom form based on the program that you're doing, but the majority have just that basic form we just went over. Once you hit that submit button, you will get a confirmation page. So the confirmation page comes up like this, and it will provide you a confirmation number as well as a date and time stamp. of the referral. It will also provide you, it'll also have all of the information that you completed in the referral. And then there is the option to download. So you would be able to download and save the referral if you needed to, or upload it into your system. That option is available once you submitted that referral. Also, an email will go to the person who sent the referral. So this is just an example of that email. It shows the referral program. This was a test, so program description. It provides that confirmation number that you would see here, and then also reminds you that you can check on the status of the referral in the portal for any context. So that email would go through. So that's really the workflow for someone to be able to send that referral. What happens to it then when you send it? It then goes to a community-based organization. We have a variety of different organizations. Like I said, we have over 300 programs. We have local health departments. We have some churches in there that offer services. We have food services. We have some behavioral health providers. We have free clinics, diabetes programs, a variety of different programs in there, and workflows that are available. So an email also goes, so we showed an example of the email that goes to the person who sent the referral. An email also goes to the organization receiving the referral. And once they receive that referral, this is what they would then come to their work list. So their work list is under a separate tile called Manage Referral. So for those community-based organizations that are on here, or people that want to receive referrals, this would be the workflow in order to receive referrals. So this would be the work list that you would have. So you would have all your patient names, gender, date of birth, who sent the referral date, the most recent status of that referral, when it was last updated, the organization that is receiving it, as well as the program name. All of these different categories here can be filtered. So if you're just wanting to look at a specific program or only those in a certain status, you can do that. This list also automatically just goes to active referrals. So anything that is pending, accepted, or enrolled will automatically show here. Oh, my apologies. Also, there's the ability to download the entire work list, which is this high level view here. You can also click select referrals to download, where you can select individual referrals and then get the additional information inside the referral, such as their date of birth, or such as their address or any of those custom form details. You're able to select which referrals you want to pull in that information. You're also able to search for individual referrals. And then we have this little view here that I call the upside down Christmas tree here. That's available to filter and see the different statuses. So that includes all the statuses such as rejected, disenrolled, and completed referrals, which we'll go into a little more. So once you click on one of those referrals, it comes to this page. It has all of that referral information we just went over. And then it comes to what we call a referral decision, or our journal entries. So one of the first decisions that needs to be made is an organization going to accept or reject the referral? And you can put in our journal entries at any time. So for example, which I'll show you on the next page as well, at any time you could put in here and say outreach, patient, no answer, submit journal. That information will then come up here at the top under journal information, where it will show what the status is happening. So here you can see on 2/9/26 that started as pending and the referral was created by the system. And then any updates after would show in the journal information. Once that decision is made to accept or reject, then additional options will come up, such as enrolled, completed, and disenrolled, to be able to update the journal and really show the life of the referral. So I'm going to show you a couple examples of what some of those journal entries look like. So on the top here, we have patient declined. So the most recent is always on the top. So we would start at the bottom where it says referral created. So here is an example of there's 3 outreaches and there was no answer for all 3 outreaches, and the referral was rejected. And then you can see the status changed from pending to rejected because they were unreachable. On the bottom example, here's an example of a patient that accepted into the program. So you can see at the bottom again, starting on 1/15/26, the referral was created, called the patient, and they were interested in the service, so it was accepted. Then they were enrolled in the service to receive 3 meals a week for 6 weeks. And then they completed because patient received all meals. This information here in the journal can be as specific or as general as an organization wants it to be. And we see a wide range of those journal updates of just basic, like I'm showing here, to more descriptive on what's happening when they're seeing the patient each time. This information about the referral is available to anyone that's on the patient care team. So when we go back to that clinical aspect of the charting for the patient in CRISP, so within CRISP, you would go to care coordination and you'd be able to see that referral history. Under the referral history, you would be able to see the date of the referral, the source. So under the source, there can be a variety of different things there. So here, if you see CRISP referral UI, that means that was sent through the CRISP referral system. But if it's a copy of a referral we get from another organization, such as Find Help, it would say Find Help there. Or if we're getting copies from other organizations, such as MAC or something like that, it would say that source. Then it would have the program name, so the name of that organization or the name of that program, and then the most recent status. So what status is that referral currently in? And then when was that last updated? So it gives you that high level list of information, and there are some filters here as well. But if you want more information about it and want to see those journal entries, you can click on that individual referral, and then you would be able to see referral sender, referral recipient, and then all of those journal entries. So once you click on that referral, more information is available to you. I did provide here at the bottom the referral status, which provides what those different main categories are. There are subcategories for some of these, such as pending, accepted, rejected, enrolled, disenrolled, and completed. One other piece that I think is important to remember is that we do have some reporting available, and this is for organizations that send referrals as well as community-based organizations that receive referral. This is available to you. It's called the pre-post report. And what you can do is you can upload what we call a roster of patients to a different site, and we can assist you with getting that set up if you're interested in this tool. And it shows total charges for all hospitals at the top. So this would be an example. You would put in a patient roster of different people that had participated maybe in a specific program. Maybe they had diabetes and you were providing them food services and you wanted to see if that had any effect on their total hospital charges. So you could see both before and after that intervention if there was any changes in the total charges, the number of visits, and the number of people that are present in both the before and after. And then there's tons of different ways to be able to filter this data. You can do it by demographic, race, ethnicity, gender, age. You can also look at it from a different time period, from 3 months, 6 months, 9 months, 12 months. You can also look at it from, oh, my apologies. You can also look at it from chronic conditions and if that changed based on the intervention. So it's a really great way to be able to show any improvements in programs based on interventions of things you're doing in the community. All right. So I am gonna, if there's any questions, I'll take that here in a minute. But I did want to let you know if you are interested, in the appendix of this handout, which we will share with the recording, there is information about the steps for onboarding, to be able to share your screener information with Chris. There is also information from a community-based standpoint on what you need to do in order to, what the steps would be to onboard and have your program listed to send a referral. Also how to, a reminder on how to send that, how to send a referral in Chris. Also, this service is available to everyone for free. This using the Create Referral and Manage Referrals for community-based organization, there's no charge. And Christian and myself both do all that, the outreach and training for those organizations. So if a community-based organization is interested, feel free to reach out to Christian, and then all the other inquiries, you feel free to reach out to me. All right, so I'm going to stop here for any questions there may be.
It looks like Christian, you answered a bunch of ones in the chat. I don't know if there are any general themes you want to call out for the rest of the group who might not have looked at that.
Um, sure. It's essentially one of the big questions is I was going to put out there is that people are asking where this is going to be made available, the recording, or how this will be made available.
Yeah, so we're gonna email it out to folks directly, but then we will also publish it on our YouTube channel and then on our public facing website. If you go to crisphealth.org, we will publish it on the social determinants of health page, tools page that we have. And I can include the link to that page in the email. So there's a couple ways you can find it.
Yeah, and the other conversation, some other ones we are having on there was talking about how the CBOs that are on the system are actually onboarded onto CRISP, and they are flagged in the system. You will know who the organizations are that are accepting electronic referrals through CRISP, but they do go through an onboarding process. This is not a like a web scraping situation.
Yep, that's correct. Let's talk through that just a little bit. So they do have to sign a contract with Chris that says that they will go into the system at least once a week to update and review their referrals. That's why it's really important for us for this, for our tool, that it has that closed loop piece, because we heard that from providers that that's really important to know that the person actually received the care. So that is a requirement that that is updated, that it's not just going to a random email inbox. And then they do have to be onboarded, and they have an HIE admin, just like all other organizations do, who limit the access of who can send referrals, who can receive the referrals, and then we map each of the programs as well to specific users that can manage those referrals. So we want to make sure it's really a safe environment where those referrals are going. We have quite a few protections in place to ensure that.
And Michelle, who can see the referrals and what can they see from the CBO point of view?
Yeah, so anyone that has access to CRISP can actually send a referral. So CBOs can send referrals to each other, which is, I think, is wonderful. To be able to, maybe it got sent to them and accidentally, and they don't service that county. They're able to then send the referral to maybe a partner that services that county. But anyone that has access to CRISP can send a referral. The limitations start happening depending on the view of the additional information. So being able to see what happened with the referral, you have to be part of the care team or have clinical access to be able to see kind of that full closed loop piece, as well as the screening information.
Anything else?
Anything else? Any other questions anyone
Folks
has?
that are definitely interested, if you want to put your name, if you want to say that you're interested in doing a follow-up meeting, I already have a couple people on my list that we're going to do some follow-up meetings with. So feel free to put your name in there and let me know that you're interested, and we'll reach out and get that scheduled. One of the questions coming in now is coming from the ACC point. ACC is also allowed to use this tool and refer. Somebody want to elaborate on that one?
What questions about the
The
ACC?
attendees anonymous, so I'm not seeing
Okay.
who it is. What about recall? Did you discuss like what they're able to see in the system, if they can see their own referrals, if they can see referrals made by other organizations?
Yeah, so again, that does depend on access. So coming back here to this list, this slide here, if you have the clinical access or you have a relationship with the patient on their care team, you are able to see all that referral information. We currently are working on also a list of anyone that has sent, from an organization standpoint, being able to have a master list of referrals sent from their organization. Sorry. So it'd be more of the, it'd be similar to what the CBO, just to kind of give you, it would look very similar to this, but this would be instead referrals that your organization has sent. So you can quickly be able to see, instead of looking at an individual patient level, you would be able to see from your organization who has sent referrals to whom and what's the status. That should be here in the next under 3 months. So coming soon, which is really exciting to be able to see from a bigger picture from an organization standpoint. But currently that's not available, but it is all available here under care coordination referral history. Great questions.
There's one coming in. So we are wondering if duplication might be happening if the CBO can or cannot see the totality of the referrals for the member. Oh, this is then we can take this offline too if we need to.
Yeah, happy to answer your question. Reach out, we can get into more details. Um, from a CBOs, usually when working with community-based organizations, they usually have a list of those that they've already served. So if it's somebody they've already served, they would just update and reject the referral and state the reason why they rejected, such as they're currently already receiving services or not eligible. So you would be able to show that based on kind of our experience currently, like not tons of referrals are going out to people. And the community-based organizations aren't really concerned about that at this moment. But if that becomes a problem, we can definitely look at other ways to safeguard that. But at this time, we would just, making sure people are connected to services is really the priority. And if there's a duplicate, it's okay at this time from what we're seeing. But if there's more questions about that, happy to have further discussions. All right. So again, this was recorded. It will be sent out, as well as all the slides will be available online, like Kevin said. And if you have further questions, feel free to reach out to either Christian or myself. And we're happy to meet with you, provide you information on how to access, as well as train or onboard additional organizations. Thank you all for your time.
Thanks, Michelle. Thanks, Christian. Bye, all.